Hello everyone, this is Amina Tadeyemo, a public health nurse. Today on this channel, I am going to discuss a very serious medical condition which is really giving me some heartache too, because it used to be the disease of the elderly. But in recent times, I discovered that the youths are also developing this medical condition, and to make matters worse, they remain undiagnosed until they develop the complications, and in some deadly cases they die. So what am I talking about? I am talking about elevated blood pressure, otherwise known as hypertension. So we are going to talk about hypertension on this channel today. And why do we need to talk about this? According to the World Health Organization, out of 4 men, one of them is hypertensive. And out of 5 women, one of them is hypertensive. And if you have 5 people that are hypertensive, fewer than one of them have it under control. This is indeed worrisome. This calls for our attention. And in a study that's reported the current trends of non-communicable diseases between 1975 and 2015, it was discovered that about 594 million people had hypertension in 1975. 40 years after, more than 1 billion people worldwide are suffering from this serious medical condition. So you will agree with me that we need to know about this. Have to discuss about it. We can't discuss about high blood pressure without knowing what blood pressure is. What is blood pressure? Blood pressure is the force exerted by the heart when it is pumping out blood and when it is getting filled up, when it is relaxing. So the blood pressure measurement is usually in a fraction-like pattern. You have a number on top. For instance, let's say 120. That is the systolic blood pressure, the one on top, the numerator. And the one underneath is the diastolic blood pressure, which is the denominator, the one under, like 120 70 millimeter of mercury. The 120 is the systolic blood pressure, the force exerted when the heart is pumping out blood, while the one underneath is the diastolic blood pressure, the force on the heart when it is relaxing, when it is getting filled up with blood. So how do we diagnose blood pressure? It is important, it is worthy of note that measurement of blood pressure is painless and it is very easy. In fact, some individuals have this machine, automated sphygmomanometer, the machine used to measure blood pressure, in their homes. But it is imperative that when you have your blood pressure measured, it has to be evaluated or interpreted by a certified healthcare practitioner. It is important. So high blood pressure is diagnosed according to WHO, the World Health Organization, when the systolic blood pressure, the one on top, is equal or more than 140 millimeters of mercury, while the one underneath, the diastolic blood pressure, is equal or more than 90 millimeters of mercury. But I need to challenge you at this point. Do you know what your normal is? Because for each individual, you have what is normal for you. For instance, an individual can usually have a blood pressure of 110 70 millimeters of mercury. So if, let's say, that is my blood pressure, that is my usual blood pressure, and if on an occasion it's measured and it measures 135 92 millimeters of mercury, then I know something must be wrong. I will know that it has to be assessed. That is the importance of you knowing what is normal to you. So please, let's be proactive about our health. Let's try and walk into any healthcare center. you will be welcome to measure your blood pressure. You have to know what is normal for you. Let's move on. So having known the diagnosis, how it is being diagnosed, having known what hypertension is and what blood pressure is, what are the risk factors that could predispose an individual to having hypertension? We prefer using the word risk factors because there is really no specific cause of hypertension, but there are several risk factors that could predispose an individual to having hypertension. Experts categorized the risk factors into two broad groups. One is modifiable and the other is non-modifiable risk factors. And as the name implies, the modifiable risk factors are the factors that you can change. You have power over it. While the non-modifiable risk factors are those that there is really nothing you can actually do. So let's go to the modifiable risk factors. Top on the list is unhealthy diets. We cannot overemphasize the importance of eating healthy on our health. So unhealthy diets that are very high in high salt intake, diets that is low in fruits and vegetables, and diets that are very high in fats, saturated fat and trans fats. All these diets can predispose you to having hypertension. Another factor on this list is physical inactivity, sedentary lifestyle, lack of exercise. They are very essential. They could predispose you to having hypertension. And on this list is also being obese or overweight. And if you can see all these three factors, they are interrelated. They overlap, because if you are not eating healthy, you are likely to be obese or overweight. If you are physically inactive, you are likely to be obese or overweight. So we can see that they are all interrelated. And on this list is also the consumption of tobacco and alcohol. Tobacco and alcohol have been identified by researchers that they contribute immensely to the development of many medical conditions, hypertension inclusive. So let's watch out. Then on this list of the non-modifiable risk factors, the very first on the list is the family history. You can change which family you are born into. You can change what kind of genes that you have. So the family history, the hereditary factors, and the genetic components that you have also play an important role in your risk of developing hypertension. And on this note, I'm going to point out to us that if you have a parent, one of them or both of them suffering from hypertension, you have a higher risk. We are not saying you will definitely have hypertension, but you have a higher risk of developing the disease. So what do you do? Do you even know what your parents are suffering from? Yes, they are attending clinic. You are giving them money. But are you interested in their health? You have to be interested in their health. And as you are interested in your health, you are already taking care of yourself, because you already know that you have a risk. You have a risk of developing what medical condition. So it is important that you are interested in the health of your parents. On this list of non-modifiable risk factor is also age. Older people that are older than 65 years of age are also known to be at higher risk of developing hypertension. And lastly on this list is the pre-existing medical conditions. You can't really choose this too. There are some medical conditions that when individuals have it, they are also predisposed to having hypertension. One of them is diabetes mellitus, another is kidney diseases like nephrotic syndrome. So all this also predispose an individual to having hypertension. In the next episode, we are going to discuss the symptoms of hypertension, the lifestyle modifications and preventive measures, and if hypertension is uncontrolled, What are the likely complications? Until then, stay healthy and always remember that your health matters. Share this video with your friends, subscribe to this channel, share the video with your colleagues, and always remember that I care and your health matters. Bye.